COVID cases are rising once again, and while doctors and experts say that it is no cause to worry, it is important that we track the cases across the country. On the back of a spike in detected infections in many states across, particularly Maharashtra, where cases rose to 36% in a day to 4,024. As of yesterday, India's total tally crossed the 8,600 mark. Daily cases are rising in Delhi, Mumbai, Chennai as well as Karnataka. While Delhi and its neighbours have witnessed a surge from late April to early May, Delhi reported 1,375 cases on Wednesday, the highest since the May 8th spike. On the other hand, Tamil Nadu's daily tally jumped by 43% in a day from 332 cases to 476 cases, while Karnataka reported 648 new cases, the highest since February 23rd. So, Dr. Gilada is still with us on the broadcast. Before we go to our reporters from across the country, Dr. Gilada, what exactly are you learning from within the medical community, sir, as far as this new spike is concerned? Is there anything worrying about it?
Number one, number of cases should worry us, but actually it is no cause of concern. Why? Because currently whatever cases are coming, they are only providing infection, and that infection is either asymptomatic or mild symptomatic. Very little hospitalization and hardly any deaths. And if you see the case fatality rate, which is 0.1%, which is same as that in flu. So if we are not worried about flu, we should not be worried about this. Secondly, number of cases are going to go up further. It is likely to be beginning of the fourth wave. But if we have seen and compared the second wave with third wave was much milder. Those numbers were very high. Similarly, fourth wave will be further milder. Now, why the cases are going up? Because there are two things. Is a waning immunity. People who have got immunity either through their natural infection or through vaccination. Those who have got natural infection, they must have got from first time or second wave, maybe third wave. And after that, 1 year is already over. So their immunity is going down. Vaccination was started in January 2021. And thereafter, some people who have taken vaccine around March, April, etc., completed vaccination, more than 1 year is over. So vaccine immunity is going down. And we have provided the gap between second and third dose to 9 months rather than 6 months. And we have been appealing for a long time, reduce the gap. Why reduce the gap? Because on one hand, you require a scientific backup, and that backup says that within 6 months, the immunity goes down after vaccination. Number two, we have enough of vaccine available in stock. There are 15 crore vaccines available all over the country at vaccination centers. And our current vaccination speed is 15 lakh a day. That means it will take 100 days to complete that stock without buying a fresh stock. And that stock is going to expire by July end. So we have only 40 days remaining. We should utilize that stock. Now, who should be prioritized? Number one, below 18 population, very poor vaccination. In Maharashtra itself, 26% children got vaccination, 1 dose, and 12% or 13% 2 doses. So speed up that. Number two, those which are below 60 and they are with comorbidity. Even below 60 people, they are given vaccination, but that vaccination is only in private. In government setup, that third dose is not available. So make available that third dose. Number three, there are vaccines available for below 12 population also. DCGI has cleared, but NITAGI committee, which is a national technical advisory group on immunization, they are not clearing. So this kind of 2-3 different committees at Government of India working at cross purposes, that should stop. They should have some emergency situation in mind. We should not act based on numbers, that numbers are increasing. Okay. Best vaccination is done when the numbers are low.
Okay. All right. Thank you so much, Dr. Gilada, for joining us on the broadcast and, for giving our viewers a bit of relief on as far as these rising cases are concerned. Let me go across to my colleagues that have been waiting patiently from across the country. Let me begin with Sujata joining us from Mumbai. Sujata, what really is the situation like where you are?
Yes, 4,000 new active COVID cases were recorded in Maharashtra yesterday, and there was a spike of 36% compared to the previous day, and 2 fatalities were also recorded. And this 4,024 new COVID cases that were recorded, that was the highest after January 23. And the State Health Minister Rajesh Tope said that the spread of the COVID-19 virus is restricted to only a few districts and not the entire state. And these few districts, they include Mumbai, Navi Mumbai, Thane, Palghar, and Raigad districts. And he also said that as a precaution, the state is increasing its testing, and also appeal has been made to the teachers as well as to the parents and the schools and colleges to increase the vaccination drive for the students and children aged 12 to 18. And talking about it, for the 4 new cases of the BA.5 Omicron variant were recorded in the state, and the patients were aged between 19 to 36, and the condition of the patients of the new variant are now stable. However, the health minister has to say that no new variant has been found apart from Omicron, and also 2 fatalities were also recorded for the virus, and the hospitalization rate here in the state is only, it stands at 40%, and the fatality rate is 1.86%. So the condition for now is stable. Masks have not been made mandatory. However, wearing mask is being advised at public places, be it school, colleges, auditoriums, cinema halls, and other public places.
Okay, all right, Sujata, thank you so much for that update. Let's quickly go across to Abhijit Bhatt joining us from Gujarat. Abhijit, what is the situation like where you are?
और जिस तरह से 184 केसेस दर्ज किए गए, तो अहमदाबाद में सबसे ज्यादा 91 केसेस दर्ज किए गए, और उसके चलते राज्य सरकार की चिंता में बढ़ोतरी हुई है। एक और कोरोना के केसेस बढ़ रहे हैं और दूसरी ओर राज्य सरकार की चिंता भी बढ़ रही है। राज्य सरकार की कल उच्च स्तरीय एक बैठक आयोजित की गई थी स्वास्थ्य मंत्रालय की, और जिसमें सभी अस्पताल, सरकारी अस्पताल और निजी अस्पताल को अलर्ट मोड पर रहने के लिए बोल दिया गया है, क्योंकि जिस तरह से केसेस बढ़ रहे हैं, चौथी लहर की संभावनाएं नकारी नहीं जा सकती, तो इसको चलते सभी को अलर्ट मोड पर रहने के लिए बोल दिया गया है। और खास करके जब गुजरात में इस साल चुनाव होना है, इस साल के आखिर में चुनाव होने, और प्रधानमंत्री नरेंद्र मोदी और दूसरे राष्ट्रीय नेता की जनसभाएं आयोजित की जा रही है, और उसमें जिस तरह से बड़ी संख्या में भीड़ उमड़ रही है, तो उसको चलते भी राज्य सरकार के लिए एक बड़ा चैलेंजिंग जॉब है, क्योंकि जिस तरह से भीड़ आ रही है और वहां पर गुजरात में भी कोरोना के केसेस बढ़ रहे, तो उसको चलते किस हालात में ये कोरोना केसेस को बढ़ने से रोका जाए और इतनी भीड़ में किस तरह से कंट्रोल किया जाए और किस तरह से स्प्रेड होते हुए रोका जाए, तो इसको चलते भी राज्य सरकार चिंतन कर रही है और उस बारे में भी सोच रही है। और आने वाले दिनों में जिस तरह से पहले एसओपी थी, उसी तरह की कोई ना कोई एसओपी जारी करे, ऐसे संभावना जताई जा रही है। जी।
Okay, all right, Abhijit, thank you for joining us with that update. Let's quickly go across to Manohar joining us from the national capital. Manohar, what really is the situation like in Delhi?
देखिए, बिल्कुल दिल्ली के हालात धीरे धीरे जो है सो भयावह होती जा रही है, क्योंकि अगर हम देखें कि लास्ट 6 महीने के बाद जो है सबसे ज़्यादा मामले कल आए हैं। देखिए, अगर हम 24 आवर्स की बात करें तो 1375 मामले आए हैं, और वहीं पॉजिटिविटी रेट की अगर हम बात करें तो पॉजिटिविटी रेट 7% को क्रॉस कर चुका है। मतलब जो सरकार का ग्रेप एक्शन प्लान है उसके फर्स्ट स्टेज को भी पार कर चुका है। लेकिन वहीं अगर हम दूसरी बात करें तो इसी हफ्ते दिल्ली सरकार और उप राज्यपाल वीके सक्सेना और उन दोनों ने एक ज्वाइंट बैठक की है, और इस बैठक में जो भी एसओपीज है, जो भी पालन करना है गाइडलाइंस को लेकर के, उन्हें लेकर के सख्त से कदम उठाने के आदेश दिए। लेकिन जिस प्रकार से दिल्ली में मामले लगातार बढ़ते जा रहे हैं, अगर हम नेशनल लेवल की अगर बात करें तो 5 राज्य ऐसे हैं जहां पर सबसे ज्यादा मामले हैं। लास्ट वीक अगर कहा जाए तो केंद्र सरकार, केंद्रीय स्वास्थ्य मंत्रालय की ओर से भी गाइडलाइंस जारी की गई थी, उन्हें भी पत्र लिख करके बताया गया था कि वो जो 5T है, ट्रेस, ट्रीटिंग और जिस प्रकार से ट्रीटमेंट की बात हो रही है, वैक्सीन को बढ़ावा देने, क्योंकि वैक्सीन की स्पीड बहुत ज़्यादा नहीं है कई राज्यों में, तो ऐसी स्थिति में कहा जा रहा है कि वैक्सीन की स्पीड बढ़ाई जाए। वहीं अब बच्चों की अगर बात करें तो बच्चों में अब तक अगर 12 से 14 साल के बच्चे हैं उनमें 75% वैक्सीन लग चुकी है, तो केंद्र सरकार ने कहा है कि इससे भी स्पीड अप करने की जरूरत है। तो अब देखना होगा कि जो राज्य महाराष्ट्र, केरला, कर्नाटक, दिल्ली, ये तमाम जो राज्य है, तमिलनाडु, इन राज्य सरकारों को अब देखना है कि वो किस तरह से इस पे सख्ती से कदम उठाते हैं। जी।
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.